Hello dearies, welcome or welcome back to the channel. If today is the first time stopping by, you are most welcome and I hope you are doing wonderfully well. So it's interview season again, and a few weeks ago I uploaded this video about nursing interview questions and answers. It's my ultimate guide to nursing interview questions and answers in Ghana. If you've not watched that yet, I'll link it at the end of this video for you to watch. Now, in that video, I spoke about a lot of questions that generally all nurses, no matter the cadre of nursing you are applying for, be it general nursing, public health, mental health, midwifery, you may be asked in your interview. But there are some peculiar questions that in answering, you have to take in consideration the cadre of nursing or the type of nursing program you are applying for. So in today's video, we'll look at mental health nursing and how you can answer some of the questions in that video and relate it well to mental health nursing, so that when you're answering your questions in your mental health nursing interview, the interviewers will know that this girl has done her homework, this girl knows what mental health nursing is about and is really passionate and ready to become a mental health nurse. Okay, so let's dive right in. So before we get into the interview questions, let's learn a little about mental health nurses and what they do, so that will be the foundation for the answers you give in your interview. Okay, so mental health nursing, or psychiatric nursing as you commonly call them, is a specialized field of nursing practice that involves the care of individuals with mental health disorder or problems with addiction and substance abuse, to help them recover and improve their quality of life. So here you are specifically going to take care of people of all ages with a mental condition or a behavioral disorder or with addiction problems. Someone is hooked on alcohol, doesn't know what to do with him or herself, so that person can come to you for help. Someone is mentally ill, like the schizophrenias and all that you will learn in school, they are all mental disorders that you take care of. So most times your clients or your patients are not physically sick, but again, it's the mind, it's the brain that is in trouble. And so that is where your care is needed. Now let's look at some of the roles and responsibilities of a mental health nurse. Most times your job is around assessing. You are always assessing patients and discussing their condition with them. So as a mental health nurse, you talk a lot. So communication is one important aspect of mental health nursing, and they do one-on-one therapy sessions. And on the field, you can work alone or with your colleague mental health nurses in your own unit, where you attend to patients, you do the consultation, you do the treatment, you plan the treatment that you give your patients, and also follow up on their treatment. You follow up on their families, you engage the family in the care of that person, because mental illness is a very sensitive issue. It can lead to, if you don't take care, stigmatization will set in, neglect will set in, and that is why on the streets of Ghana you see a lot of mentally challenged or mentally ill people walking around dirty, in tattered clothing and all. It's because of neglect and stigma. That is why they are on the street. Other than that, the families would have been taking good care of them and getting them the necessary help. And sometimes it's just some simple drugs or medications that would have helped that person's condition. I'm getting carried away. Let's come back. And so because of that, a mental health nurse should also possess all the qualities of a nurse. Okay, generally when you Google or research the qualities of a nurse, all of them apply to a mental health nurse. But because of their specialization and their peculiarities with their patients, as a mental health nurse, one very good quality you should have is communication. You have to be a good communicator. You have to be observant, because most of the signs and symptoms of mental disorders are shown by the behavior of the person. You have to have good judgment skills to know when somebody is behaving normally and abnormally, okay? And also good problem solving skills. You have to be someone who can give good advice and have people skills, okay? Because it's a lot of talking. You are going to be talking a lot. You have to convince families why they should include the patient in the home and create an environment that is conducive for that person. Okay? So that being said, when they ask you, why do you want to be a nurse? You are going to tailor your answer to suit mental health nursing. Okay? You are not just going to be any nurse, you are going to be a mental health nurse. So sometimes they can ask you, why do you want to be a nurse? Or why do you want to be a mental health nurse, or why do you want to be a psychiatric nurse? It's the same adequate. It's the same response you give. Okay. Now, when answering why do you want to be a nurse or any why question, it's seeking to know your motivation, why you chose this above all else. Why this? You could have been a teacher to help children grow. Why are you not being a teacher? So your personal conviction, what made you choose this? And if you don't have a why, then why are you coming here? Okay, so personalize it. Even though I'll give two examples on how to respond, it has to come from you. Then it will be more genuine. It will show your passion. It will show your personality. Okay, so bear that one in mind and use the examples just as a guide. Okay, so example number one, I can say I want to be a mental health nurse because I have a strong passion for helping others and making a positive impact in people's life. I believe mental health is just as important as physical health, and I want to break down the stigma associated with mental illnesses. Now, with a response like this, see, I've used jargons like stigma and mental health. So, an interviewer can choose to follow up on that response and ask you, oh, so you talk about stigma. What is stigma? Stigma, in the general sense, is a disgrace attached or associated with a particular situation or circumstance or a person. But when it comes to mental health, it is the negative or discriminatory attitudes that others have about mental illnesses. You find out that because they have mental illnesses, we treat them differently, we see them differently. You know how you behave when you see a madman coming. Ah, those are all stigma. Sometimes it's out of fear. We don't understand what is happening to that person, and so we are scared. And some of them are very aggressive, so obey anything. So that is where a lot of the stigma comes from. And they can ask you, how do you think stigma will affect the person? The person will not get the help he or she needs. They don't see the person as part of the family anymore. They don't, because mental illness is something that culturally we frown on. So if there's a history of mental illness in your family, when you start acting helium kakra, people will start thinking, hey, there's a bodam in the family also. Hey, so that is why most times we don't want to associate ourselves with people who are mentally ill. And so because of that, there will be neglect and the person will not get the help that person deserves. Okay. So when you formulate your responses, look out for words that you are using that you yourself do not understand and find meaning to them, or try to form your own follow-up questions. So if they ask me this, what will I say? If they ask me that, what will I say? Okay. All right. So another example is, throughout my life, I have always been a good listener and a source of support for my friends and loved ones during difficult times. This ability to connect with others on an emotional level led me to pursue a career in mental health. I want to utilize my skills to offer a safe and non-judgmental environment for individuals to express themselves and receive the care they deserve. Okay, so maybe you'll be seeing mad people I keep saying mad people, but that's not the right word to use. You'll be seeing mentally challenged people, mentally ill people on the streets, neglected, dirty, and in tattered clothes, and something in you moves, okay? When you study mental health, you see that all of us walking on these streets are struggling in some way, somehow, mentally. So a lot of it is just emotional support the person needs. It's just emotional support. So if you have that ability, if you're empathetic and you are emotionally strong to support others when they are in their moments, then you can bring something like this up to be your reason for wanting to become a mental health nurse. Or there is a history of mental illness in your family, so you want to understand it more, or you've witnessed the effect of mental illness on people's lives, you can bring out such reasons why you want to be a mental health nurse. Or the career is appealing to you. What about the career is appealing to you? Okay, so you are not just applying for any kind of nursing, you're applying for mental health. So form your responses to suit mental health nursing and include mental illness. Okay, then we see that girl, she knows what she's talking about, or he knows what he's talking about. I'm not forgetting my voice. Yeah. All right. So that's one of the major questions that you can get asked in your interview. Other questions could be when they ask about the roles. What do you think the role of a mental health nurse is? And that I have spoken about. They do assessment, they do counseling, they plan treatments alongside other professionals like the psychologists and the psychiatrists and all to better the person's life, to improve the person's standard of living. Another question you can be asked is why you chose mental health or psychiatric nursing over other kinds of nursing. Why didn't you go for general nursing? Why didn't you go for public health or even midwifery? Why do you want to be a psychiatric nurse? And this one can only come from you. What is appealing about mental health nursing to you? Maybe the patients you feel need more help. Maybe you've not seen a lot of mental health nurses around, so you feel like there's a gap and you want to fill it. That's not a bad idea. So, what is appealing to you that made you choose mental health nursing? You can also be asked if you've ever visited a mental health facility and what was the experience for you. Have you ever been to, if, for example, if you live around Pantine, the Pantine Psychiatric Hospital, have you ever entered? Have you ever seen a person on treatment? What was the experience for you? Have you shared that experience? If not, you just say, oh, I've never been to a psychiatric hospital, and so I have no experience in that area. Nobody's gonna beat you, all right? Or another way they can ask you this question is if you've ever seen a mentally challenged person and what comes to your mind. What comes to mind if when you see a mentally challenged person or mentally ill person, or when a mentally ill person is on the street, how does that make you feel? Like, you know, all of these ones are personal. Only you can answer this question. And also, because you are going for mental health nursing, they can ask you logical reasoning questions to see if you yourself, are you a fast thinker? How is your thinking ability like? How is your reasoning like? And I'll also make a video on that. If I do that, I'll link it here. But in the meantime, click on this video to see the 30 interview questions and answers that I have shared. Try your hands on them. If I'm asked this question, how will I answer it in my interview so that in case it is asked, you don't find yourself wanting. I hope this video was helpful. Like this video, share and subscribe if you've not done that yet. And I wish you all the best in your nursing interviews. Bye.